name is Deanna Andrews, and I'm here to present PowerPoint on reducing surgical site infections. Our first slide is surgical site infections and what the problem really is. Recently, it has been in the top list of healthcare associated infections, and it is the responsibility of the nurse and the staff to ensure that these key interventions that we're going to talk about will help reduce the risk of surgical site infections. According to multiple studies, approximately 5% of all surgeries develop a surgical site infection, and this is a real problem. And we didn't realize it until recently because we're beginning to think that it just wasn't being monitored as closely as some of the other infections like pneumonia, associated with ventilators and things like that. So, and when we get a surgical site infection, it can increase the patient's stay 7 to 10 days and sometimes even more, depending on the infection itself. And the biggest problem is the patient, of course. They suffer from lots of pain, finances, because we all know that finances are not always readily available. Causes of these surgical site infections, well, we always have to have a source, and that's the microorganism itself. And of course, I've listed some of the top microorganisms that cause these infections. And we, of course, have to have a host. That would be the patient or the surgical site. And the surgical site itself can always be a main factor. What kind of wound is it? Is it superficial? Is it a deep wound? So that plays a huge role, and